Meet Grace. Grace is a 28-year-old female who had an abnormal pap showing atypical squamous cells of undetermined significance, or ASCUS, 6 months ago. She was recently tested again, and cytology continued to show ASCUS. Upon this second ASCUS finding, her doctor sent her for a colposcopy, which revealed a diagnosis of CIN1. Her doctor has told her that nothing needs to be done at this time, as the majority of CIN1, or LSIL, low-grade intraepithelial lesions, cases will resolve on their own, and has recommended that she return for testing in 6 months. She has not been tested for HPV, as this is only recommended for women over the age of 30. But Grace is really worried about developing cervical cancer, and after doing some research online, she saw that between 30 to 60% of cervical dysplasia cases progress to cervical cancer when left untreated. Also, her friend told her that treatment for more severe dysplasia may result in fertility complications. She has come to you in hopes that there is something that can be done to help improve the regression of cervical dysplasia now so that she can avoid further invasive treatments and reduce the risk of this turning into a very aggressive cancer. Cervical cancer is an extremely aggressive cancer that, once diagnosed, has a 67% 5-year survival rate. Worldwide, it is the 4th leading cause of cancer deaths in females, and the 3rd most commonly diagnosed cancer. It should be noted that in Canada, these rates are much lower, as the initiation of screening procedures have significantly lowered the incidence of cervical cancer diagnosis and the mortality rate. In women under 20, cervical cancer is rare. The peak age of cervical cancer is between 40 and 50 years of age. However, cervical dysplasia incidence peaks in women in their mid-20s. So what causes cervical cancer? The biggest risk factor, now considered the ecological agent, is the human papillomavirus, which affects up to 80% of sexually active women. HPV can result in an increased inflammatory cytokines and increased biomarkers of oxidative stress, making cells more vulnerable to the development of cervical dysplasia and eventually cervical cancer. Cervical dysplasia rates peak at around 26 years of age. This means while it is rare to see women in their 20s with cervical cancer, it is not uncommon to see women develop cervical dysplasia.
So what can be done? When researching a treatment protocol for Grace's diagnosis of level 1 cervical intraepithelial neoplasia, also known as CIN1, you find common interventions with good evidence include folic acid, B12, and beta-carotene. What sparks your interest is the new and emerging evidence surrounding selenium supplementation and cervical dysplasia. What is selenium? Selenium is an essential trace element that plays a key role in major metabolic pathways in the body, has antioxidant properties, and protects the body from the deleterious effects of heavy metals. Selenium has been hypothesized to reduce the risk of cancer through increased expression of selenoproteins, which are proteins that depend on the action of selenium. These selenoproteins have antioxidant properties protecting against DNA damage and enhancing DNA repair. This mechanism might suggest the importance of selenium supplementation during cervical dysplasia to prevent malignant transformation and proliferation towards cervical cancer. What does the evidence say for selenium supplementation and cervical dysplasia? One study reported that women with cervical dysplasia have significantly decreased mean serum selenium concentrations compared to those with normal cervical epithelium. Furthermore, a recent double-blind randomized control trial done in 2015 took women with a diagnosis of CIN1 and looked at the effect of selenium supplementation on the regression rates of these women. After 6 months of supplementation with just selenium at 200 micrograms per day, the intervention group showed a regression rate of 88% versus the 56% regression rate seen in the control group. Additionally, it was found that within the intervention group, lipid profiles and insulin resistance improved, and there were reduced serum biomarkers of oxidative stress. This evidence suggests that Grace may benefit from selenium, so you recommend 200 micrograms of selenium a day. While selenium is shown to be effective for women with cervical dysplasia, selenium is not an effective preventative intervention. Studies have shown that when taken prophylactically, selenium has no protective effects with regards to the risk of cervical dysplasia and cancer. Additionally, selenium toxicity is a risk that has to be considered when dosing patients. Research has found that selenium has the most potent impact in states of deficiency, but most healthy women in Canada get adequate selenium and are not deficient. The exception to this is women with cervical dysplasia and cervical cancer who, when tested, have shown to have lower levels of serum selenium. Therefore, it is appropriate to suggest short-term supplementation of selenium to women who have confirmed cervical dysplasia. That being said, selenium has not been shown to be an effective treatment 1 cervical dysplasia has progressed to cervical cancer, and in this case, more aggressive conventional treatment options need to be considered. After 6 months of treatment, Grace went back for a follow-up test and has received a normal Pap result. She will be tested again in 6 months to ensure that these results remain consistent.